Hello, everyone. Mike Mosquito with the Buzz Podcast here on location this week with my co-host, Maureen.
Eileen.
And we're at the HIMSS Texas Regional Conference here in Dallas, Texas at the wonderful Gaylord Resort. We're here with Ronke Komolafe, here talking about mental health and integrated health. And we want to make sure we cover this topic because it is paramount in our society today that mental health gets addressed. And I think you've been doing an excellent job at attacking this rampant problem in society. A little bit more about what you're doing. Share with the audience what's happening in your world.
So when we talk about integrated health and mental health, it's really about looking at a whole person from the ground up, looking at your body, mind, and spirit. How do we ensure that all aspects of healthcare is being addressed? So what I really focus on is helping providers, healthcare technology, and health system integrate mental, physical, and social health from the perspective of a payer, policymaker, patients, provider, and technology.
Nice. And with that coming in the forefront, because I work with a lot of folks that have mental health. I have an AI app that addresses mental health for gambling and addiction. And I don't think there's enough resources out there or attention on it that people know where to go to get help. And there's a stigma against actually getting help. How do you address that in your care delivery planning?
Personally, my organization has a resource pool on a state-by-state level. So if you tell me a state, for example, I can look at your zip code and give you a list of providers you can go to. That's not something we give out publicly. But a lot of times, if you have insurance, just call your insurance and they'll direct you to the right person to go to. And a lot of times when it comes to mental health and integrated health, the patient has to be ready, right? You have to be ready to succeed. You know, it's not okay to be in therapy for 10 years. That's no longer therapy, right? That's hanging out with your friend, which is okay. But you need to know the difference, right? So when it comes to mental health, the patient has to truly know what they want, what's going to work for them, and shop around. You don't have to stick to the provider you've been referred to.
I'm just so pleased, though, that we're really looking at mental health, not just as a singular disease that needs to be managed, but rather holistically, because there's no way to extract your mental health from your physical health. One just bleeds right into the other. So what inspired you to be a part of this work?
Oh my God. So early on in my career, I worked for a Zona Medicaid called Access, and Access was just diving into integrated health. And I got to be one of those that worked closely with the Department of Behavioral Health and the Rivers, which are the health plans that manage mental health. And that's how I got exposed into that field. And I loved it so much, I decided to go get my doctoral degree in behavioral health management with a focus on integrated health.
Wow, that's beautiful. That's beautiful. We definitely need more practitioners like you working in that space, removing, as you said, the stigma and elevating the resources that are available, because we all need a little mental health assistance. That, truthfully, we do. And it's not something that we should dismiss, and it's not something that we should stigmatize.
I know. She stigmatizes me all the time and calls me mental.
I can hook you up with Ronke here, and you all can chat with where he can find resources.
I need it on days when the buzz is doing buzz down. Now, I really appreciate you for taking on this challenge of mental health, because I've seen it in our nightly news. So all you got to do is turn on the nightly news and you see where our society is going on this topic. What do you think is missing and paramount right now that every healthcare institution should be focusing on?
We don't get enough of mental health and specialty medicine. And I'll give examples. Congestive heart failure, right? Or cardiology. Right. Some of the symptoms patients experience are very similar to anxiety, right? A lot of panic attacks happens where people go to the emergency room thinking they're having a stroke, but they're just having a panic attack. And a lot of times we don't give them the resources and the services they need in the emergency room to address the anxiety. In other areas of specialty medicine, for example, urology or even ophthalmology, eyes, tell somebody they have macular degeneration, they're going blind. There's a lot of anxiety and depression that goes with that. When you talk to ophthalmologists, they don't think about that. They're just thinking about treating the eyes. So for every underlying physical health out there, we need to be looking at the mental health symptoms that's so related to that or has a similar symptoms to that in order to truly treat the patients.
Because you're going to get better outcomes that way, right?
And ultimately, mental health, you want people to get better, right?
Yeah, but we don't want you to stay sick, right? You often hear people say it's okay not to be okay. That's true. But it's also okay to take steps to be okay, right? Let's continue to take steps to be okay. Very rarely do you see somebody happy 100% of the time, 365 days of the year. Very rarely does that happen. And when it happens, we need to check that person, right? Because sometimes it's a camouflage for true depression, right? So I think sometimes we just need to always check in and ask people the right questions.
I never understood that either. It's okay not to be okay, but finish that sentence, all right? I never heard the second half of that sentence.
And now what do you do with it's okay to not be okay?
So I'm just sitting and not okay.
Okay, great. I'm not okay.
You need to take steps. Take steps to be okay. And what does that step look like for you? There are two ways to look into getting mental health services, or three ways. One of it is going to an expert saying, this is what I need. I'm going through the symptoms. What should I do? And then they'll guide you through it. Be it therapy, be it medication, or be it a different type of modality or treatment, so it works for you. Another way to approach this is you go to the specialist, the expert, mental health expert, and say, I'm going through this, and this is what I need because I know myself well. And they can guide you. And the third one is you both collaborate, right? That's called patient engagement. You know, physicians always want this. Collaborate. This is what I'm going through. This is what I think I need. From your expertise, what do you think? And they as experts should be able to hold your hands and partner with you to help you achieve success.
We want to thank you, Ronke, for joining us on the podcast here at Regional Hymns. I think that Texas has been done a great service by having you here.
Thank you.
Having you join us. How can everybody that's listening, how can they find you?
You can find me on LinkedIn, or you can go to our website, www.advancingih.com.
Very well done.
Thank you.
Thank you for joining us.
Thank you so much.
Again, this is Mike and Maureen on location at Texas Regional Hymns, and we hope you're enjoying the conference. We look forward to seeing you soon. And until next time, keep buzzing.